Hi everybody, thank you for the invitation. We are very excited and proud to be here presenting how the nurses of Humanitas Research Hospital managed the COVID-19 pandemic. My name is Elena Garofalo and I am the Directorate Nurse Manager of the medical area and I have worked in the front line during the pandemic. Together with me there is Paola Perti, an ICU nurse who is going to continue the presentation.
Hi everybody, thanks Elena for the introduction. My name is Paola and the title of our presentation is Reorganization and Management of Nursing Staff during the COVID-19 pandemic, the experience of Humanitas Research Hospital. Humanitas Research Hospital is a highly specialized teaching and research hospital sited in Milan. It combines specialized center for the treatment of cancer, cardiovascular disease, neurological and orthopedic disorders, as well as an ophthalmology and fertility center. During the COVID-19 pandemic, the hospital has been completely transformed. It moved from being a multi-specialty hospital with high technology to an hospital with a strong focus on infectious diseases, with the majority of patients affected by COVID-19. In the meantime, the hospital was the local stroke center and hub for oncology patients, according to the national and local guidelines. Our hospital, as you can see from this slide, is usually divided into 8 departments, and each department has a director nurse manager. Elena is the Director Nurse Manager of the multi-speciality area, which include different medical and surgical specialties. As we said, during the COVID-19 pandemic, the hospital was completely reorganized. Elena was in charge of managing the COVID-19 pathway from the triage to the admission in the ward or in the high dependency unit, based on the intensity of care required for the patient. Let me give you a bit of background. So, Italy was the first country affected by COVID-19 in Europe. At the beginning of March, on the 8th, the Italian government declared the full lockdown. At that time, most of the cases were in our region, Lombardy. On the 11th of March, the World Health Organization declared the COVID-19 pandemic. In our country, the numbers increased quickly. Especially in our hospital, we started having 3 patients per week in the first week of March to over 300 patients after only 4 weeks. So in total, we treated 780 patients from the 1st of March to the 29th of April in Humanitas Research Hospital. We had to act promptly to face the situation. So how did we manage it? First of all, we created a crisis committee to analyze the problems and take decisions. Secondly, we had to reorganize the hospital layout, increasing hospital beds. Then we focused on the education of the staff, but we also had regular debriefings and staff surveys. So the crisis committee included representatives from each department, such as hospital directorates, medical and nursing management, human resources, building and facilities management. They used to meet daily in order to discuss the problem and take shared decisions. In relation to the hospital layout, we made some relevant changes. First of all, we created 2 different pathways in the emergency department in order to separate suspected or positive cases from the negative cases. Then we installed 4 tents outside the hospital where the patients were under observation while waiting the hospital bed in HDU, so high dependency unit, or general ward. So since the admissions were rapidly increasing, we had to progressively transform 8 wards into COVID wards, allocating the patients by intensive care. But at the same time, we had to increase ICU beds for COVID-19 patients. So at the beginning, we didn't have any ICU bed for COVID patients. And our general ICU and the cardiothoracic ICU, they weren't enough. So we had to set up the operating theaters with ICU beds for COVID patients. And we created up to 45 beds. In this slide, you can see a brief layout of the wards and that we progressively transform into COVID wards. So by the end of April, we had 8 general wards as COVID wards. In this slide, you can actually visualize the tents that were placed outside the hospital. With respect to the staff education, Humanitas University played an essential role. Let me expand on that. We initially had to train all the staff to use the personal protective equipment. We trained nurses, healthcare assistants, physiotherapists, doctors, perfusionists, clinical engineers, and all the support staff that work in a COVID environment. We recorded videos in the simulation center of the Humanitas University, and we made them available on the hospital intranet, so they're still available for every member of the staff. Let us now focus specifically on the education of the nursing staff. For the emergency department, we created algorithms to help nurses during the triage. This slide shows an example of an algorithm that helps nurses to take decisions in order to follow the correct pathway and to choose the right destination for patients. This allowed nurses to gain autonomy when treating COVID patients. With respect to the nurses working in the general wards, the trainings were focused on the oxygen therapy devices and the non-invasive ventilation, but also on the arterial blood gas procedure and its interpretation and the blood cultures procedure. But the complexity of the situation was represented by the fact that the COVID patients were deteriorating very quickly in the ward. So the nurses had to handle different emergencies, and they often needed to escalate the care of the patients and transfer them to the ICU. In relation to the intensive care unit, many nurses with little or no previous ICU experience were moved to work there. University tutors and senior nursing staff made a huge effort to support them. They recorded videos and lectures regarding nursing care during CVC insertion, during endotracheal intubation and bronchoscopy procedure, about the invasive ventilation, all the mode and settings, the assistance during the endotracheal suction with closed suction system, and the arterial blood gas interpretation, but also the blood cultures procedure, to try as much as possible to facilitate them. Thanks to regular debriefings and staff surveys, we can confidently conclude that our nurses were flexible, able to work, to adapt in a new working environment with different colleagues. They demonstrated mutual help and support, a really important component in such a difficult context. They always showed empathy between each others and towards our patients. They were always focused on patient-centered care, and they handled critical situations with strong problem-solving skills, and they never gave up. From the debriefings and surveys, we also understood what we could improve. First of all, from the need to increase hospital beds and to keep separate infected patients, we built the Emergency Hospital 19 in just 11 weeks. It is a building beside the hospital where we have 27 emergency departments beds, 20 ICU beds, 17 single rooms with telemetry, 1 operating theatre, and a CT scan and a cath lab. Thanks to this project, funded by Intesa Sanpaolo, an Italian bank, we were able to clear the main hospital from COVID-19 patients, with the exception of some general wards. Secondly, we wanted to fulfill the learning needs of our nursing staff. So we constantly updated, and we still do, our learning platforms with articles, papers, and videos on the latest guidelines of COVID-19 patients. The videos and the documents are still available for every staff member, and it is a very relevant resource for new employees and nursing students. Moreover, the staff expressed the counseling need, so we activate a counseling service with a team of psychologists, free and available to every staff member. This service was activated during the pandemic, but it is still available and it will continue to be in the future. In this slide, you can actually see the picture of the Emergency Hospital 19 that is beside the main hospital. Before concluding this presentation, we wanted to share with you a short video that was recorded in our hospital during the pandemic, in occasion of the National Worker Day on the 1st of May 2020. The video is about life during the pandemic at Humanitas Research Hospital. In addition to that, for those of you who want to listen to a song dedicated to our staff, we leave you the YouTube link on the slide. Thank you for your time and for listening to our presentation.
Pomeriggi vi chiamiamo per darvi delle informazioni su quello che è successo durante la giornata, visto che voi non potete venire qui.
L'abbiamo svezzato molto rapidamente, da 48 ore lui è in respiro spontaneo.
Ha detto che stanno tutti bene,
Non ha bisogno di ossigeno, respira.
Lo so, siamo molto arrabbiati noi.